I'm talking with Quayle, and we are working through this document, and there's an awful lot about health and social care for the Isle of Man for the next 5 years. Obesity, poor diet, lack of exercise, smoking, drinking too much alcohol. We touched on that in the last one. But of course, actually, smoking and alcohol does bring in the money to the coffers. So you kind of got that double-edged sword, haven't you, with the government?
Well, it is. I think we spend a little bit more looking after it than it brings in.
Okay. Many patients are admitted for treatment or care which could be delivered at home if you reorganise your services to do this. What exactly are you talking about reorganising and delivering at home?
Right, well, GP surgery is delivering more walk-in centres for the island, more screening on the island. So instead of everyone going into Nobles Hospital to have their blood taken, obviously we're always going to have a blood clinic at Nobles for people who are in the hospital, but why don't you go to your local GP or a local centre on the island to have it taken? Telemedicine, I've seen instances where you can have a Skype conversation with your consultant from your home. So instead of having to go to Nobles, you can have a Skype interview with them. There are all sorts of ways of improving it. I mean, we're never going to stop everyone going into Nobles, but we can reduce...
Decentralisation is to some... I mean,
Yes.
I've heard about the blood clinic being overwhelmed at times. I don't know if that's true, but you hear these things that they really do have an immense amount of people wanting their bloods tested. In the old days, maybe the GPs did it. They now send it automatically. Do they to Nobles instead? And that's caused a sort of a bit of a pinch point there.
Well, if
you're now trying to reversal that.
Yeah, well, also, Paul, there's a new initiative, which if you've heard in the last fortnight, where the pharmacies are going to deal with more minor ailments to try and take some of the pressure off the GP system. So it's just trying to get more done in the community. And as I say, if we can do more screening as well, and fitness initiatives, more education, and as I say, back to the prevention is better than cure, then we can reduce. And it's not just us thinking up some imaginary figures. It's been shown that if we can deliver properly on that model within 3 years, other areas have seen a 30% reduction in hospital admissions, and that has enabled them to plateau their health costs. At the moment, health costs are going through the roof in not just the Isle of Man, the rest of the world. So I'm keen to stress this isn't a unique problem to the Isle of Man, but I don't want us to be the last in the queue trying to solve the issue. I want us to be at the forefront.
You're holding up the Ramsey District Cottage Hospital as an example of how things are going up there, and again, this is a sort of micro level, isn't it? Smaller areas to deal with. But only 60% of the beds space is being used on average, and you're looking to turn some of the available beds into a step-in, step-down unit.
Step up, step down.
For people who'd otherwise spend a longer time at Nobles Hospital, for instance. Explain, please.
Right, well, two elements to that. First of all, you're living at home and you're struggling to look after yourself at home, and it may well be that you've got to go into a care home. Now, it could well be that with 2 to 3 weeks of intensive care in a step-up, step-down facility where you're worked on from your diet, exercise, to get your strength up, and educated on enabling yourself to look after yourself better at home so you don't have to go into a nursing home. You'll be assessed as to whether your body will be capable of taking part in that exercise. It's not for months and months and months of care. This is sort of a 2-3 week system. Equally, you're in hospital, you've had your treatment, we've done all we can for you, but you're not quite ready to go home. We don't want to discharge people from Nobles Hospital to go home and then have a fall because they're not strong enough and able to look after themselves. So we can put them into a step-down facility such as Ramsey Cottage Hospital for the north of the island and Southlands in the south of the island, where you're built up, the patient is strength and ability to look after themselves is built up to a level that we can then discharge them home confident that they will be able to look after themselves.
Are you going to lose beds in this scenario, though? Is that anything going on there? I'm reading here that...
Yes, we will lose a small number of beds in Ramsey District Cottage Hospital. Because we're going to turn... Well, A, they're not being used, and we're going to turn them into beds for step-up, step-down facility.
Yeah, but... overall, there will be a reduction in the amount of...
but we're only talking a small number of beds, but I think if you look at the amount of beds that we have on the Isle of Man compared with the with areas in the UK, we have a high percentage of beds per population, hospital beds, and that's an expensive way of delivering your health care.
So an integrated plan, integrated care hub, I think is how you're putting it here. Is you see that as a way forward?
Yeah, definitely.
Okay.
It's got to be from a if you look at it boils down to pound, shilling and pence. From a pound, shilling and pence point of view, looking after people in the community, it's a lot cheaper. Hospital is £250, circa £250 a day, and that's without having to do any operation. If you've had to go into a mental health facility, either on or off the island, the average cost is about £3,500 a week, and a nursing home care can cost up to £950 a week. So if we can enable people to live in the community, it's better for the taxpayer, but just as important, if not more so, it's better for them living in amongst your own surroundings with your family and friends and community around you. It's got to be a far more enjoyable experience than being in acute care.
So alternatives residential care, including shared live programs, developing the respite part of this, so other people look after people rather than the get in hospital and stuck in hospital. I mean, how are we doing on this business of you passing laws to make sure people leave hospital by law? I mean, did you really have that many people that you have to pass a law for this?
We unfortunately, the vast number of the population, 99% of the population, love their parents, their family. They want to care for their parents and see that they get the very best care. But sadly, there is a minute percentage, and it's in all boards. And this is a law that Howard isn't wanting, and we're different from the rest of the UK. The UK already have these powers. These are people who have not been in hospital. It's not a case of you're in hospital and you're not happy with where you want to go and we're going to kick you out. These are, after a week or so, these are people who have been in Noble's hospital for years, Paul.
Is this granny dumping then? I mean, who's doing it? The next of kin don't want...
The next of kin don't want the parent. They're happy to take the parent's house and money, but they don't want the parent back and the cost associated.
It's quite incredible to hear that.
It is, and as a politician, I haven't been exposed, in my normal, I'm at the end of the day, I'm a member of the public. In my circle of friends, we just don't come across this sort of thing. And most people listening to this interview will think, well, Howard's giving them a load of rubbish. But I'm sorry to say, a very small number of people are abandoning elderly family members. And
this is years. They're
years.
In the hospitals.
We're not talking
There's nowhere
months.
else to go because they won't let them...
They won't let them move out. And it's not good for them. Now, we had a case which I personally came across, and it was better for the person to be moved into a nursing home, and then we took the family on. So this gives me the powers to ensure that this sort of scenario can be stopped and won't happen again. Okay. But please be assured, Paul, we're not out there to people who are vulnerable and are worrying where they're going to go. They're not going to be suddenly...
They will be shut on the door, stepping up the Nobles and waiting for a taxi to take them somewhere.
Right. That's not the power I'm wanting. I'm looking to go after people who've long-term in Nobles.
Hold it there.
Or Ramsey District Cottage Hospital.
Okay. Loads more. Join us as our extended interview with Howard Quayle continues on MT TV.